We are worried about the trend, and there's a risk of further increasing. I think the elderly home is a reflection of the community outbreak, because you have a community-wide outbreak, and then it will also affect the elderly homes because there are workers working there. Some elderlies in the community in the elderly home can go out and get infected. So of course the elderly home can stand up, has already started up infection control measures, restrict sharing of staff, and also tightening the infection control measures. But it is very difficult because we have community outbreak outside, so it's very difficult to isolate the elderly home and not get them infected. So I think the main strategy is to control the community outbreak at large, so that prevent further extension of infection to the elderly homes. In general, we will advise the workplace to arrange home office as early. If they can, please arrange home office for everyone to prevent outbreak. If it is is necessary to have the office, try to reduce the number of employees and ask them to wear masks during work, and space out lunch hours. Try to avoid the workers to have gathering or lunch together without mask. And if some of the colleagues, some of the workers in the company or the restaurant are infected, before we can find them, before we can get in touch with the company owner, maybe the company owner can arrange home office or try to stop the service as far as feasible, and get a list of the workers and other people who may get in touch with the affected cases, and then wait for our call to define who are close contacts and who are not close contacts. In general, close contacts are those people who might get in touch with the worker 2 days before his onset of symptoms until isolation. But if there are more workers affected, we are worried that there may be an outbreak earlier on. So we might strongly advise those premises to close and disinfect.